Access to dental care is one of the big challenges for many underserved populations in Oregon. What we have been trying to do is to establish teledentistry project using teledentistry to improve access to dental care, especially for underserved children in the rural areas of Oregon. Teledentistry has turned out to become one of the new features of trying to access dental care in a new way.
Teledentistry is interesting to me in terms of finding a different tool or facet that we can reach the populations that have difficulty in attaining dental care and trying to figure out the best ways that we can provide care to those populations in the future.
We have been doing teledentistry project since 2014 with our collaborators, Capital Dental, which is a dental care organization. This project generally started as a workforce pilot project under state legislation where we were trying out different workforce models.
We started in 3 elementary schools and 2 Head Starts. And fast forward 4 years, we've added an additional grade school serving pre-K through 8th grade. In addition to that, we have expanded within our organization where we are using this model in pediatric medical offices, OB clinics, recovery addiction centers, and coming soon a pilot in a hospital setting in a local hospital.
We have a lot of training in terms of the epidemiology as well as the need for care for rural citizens, but there's also the realization that there's not going to be providers in some of these areas.
What we have been using especially is asynchronous combinations of teledentistry where our dental hygienists in the field are examining children.
We are essentially going to the school-based health centers and providing on-site services.
Producing all the clinical diagnostic material that is being used by a dentist.
Intraoral pictures, record clinical findings, and also do portable radiographs and send all the information to the dentist, who then decides and diagnoses and treatment plans what the patient needs and if the patient can be kept healthy in the community.
The main thing of using teledentistry methodology is really to try to keep as many children as possible healthy in the community, rather than trying to get them referred to clinical spaces.
So far, we have provided dental care through teledentistry to more than 700 patients. And during the initial visit, we had seen that about 50% of the children had caries, untreated dental decay. And we also found that about 50% of the children could be kept healthy in the community, which meant that they didn't need referral to the dentist, and the needs that they had could be addressed by the dental hygienist itself in the school-based health center.
The populations that I serve, very low socioeconomic status, very low health literacy, several barriers to care, some neglect in some of the homes, high incidence of addiction in the homes. It's really hard for them to receive routine dental care in a traditional dental setting.
Patient satisfaction rate has been quite high in this type of setting because they are able to avoid all those barriers which keep them away from the dental clinic, including transportation barriers, taking time off work, dental fear also. Since children see each other being treated in a setting which they know and they work and study together, it's easier for them, and dental fear is not a problem, so it's a good modeling practice as well.
Several people that I treat have never been to a dentist. Us bringing these services into the community where they're already living, working, playing, and going to school, we're providing opportunities for these families that otherwise would not have an opportunity to get dental care.